Dr. Tammy Penhollow in Las Vegas getting robotic laser, the Class 4 MLS laser. And what's going on, Dr. Penhollow? What's going on with that shoulder of yours?
5 weeks ago today, I had a right rotator cuff repair and right labral repair. I traveled to Texas to be treated by one of my colleagues because I knew that we'd not only be able to do a great arthroscopic surgery, but that he would use my own healing cells from my bone marrow to augment the therapy. So we put that in the humerus, inside the tendon that was repaired, and into the subacromial space. And I've been since splinted with my shoulder at my hand at my side for the last 5 weeks, and I got very restricted range of motion as scheduled, and I'm due to start PT next week.
So you're ready to go, and you've got to get this shoulder ready to go. So you've got world expert Dr. Rowan Paul here?
Yes.
How is this possible? So he's got another, you're getting 2 lasers, you're getting this robotic one on your shoulder, and then Dr. Paul is putting this other handheld one on the back of the shoulder. Yeah. And we're going to also put it under the axilla to get all the different parts of your shoulder treated with laser. And so what we're trying to do with that is improve blood flow, reduce inflammation, and reduce some of the inflammation, the inflammatory chemicals that our body makes, so that your shoulder will be more receptive to this kind of physical therapy that you want to and have to start on.
Yes.
Good. So you've been teaching all day at this course here in Las Vegas about how to help people feel better, and you're using your own medicine.
Yes.
Because you're using the laser to help yourself feel better. So that's pretty cool.
Very excited.
So what are you feeling? What are you feeling?
So when Dr. Paul had the probe on the back of my shoulder, I did feel some pressure. It didn't hurt.
Okay.
When we had it underneath the armpit, where I would normally apply deodorant, I felt a little bit of a vibration.
Okay.
Maybe like we were tickling the nerve, but again, it wasn't painful.
Okay.
And for the shoulder focus right here, I don't feel anything.
Got it. Can we put the hand one under the armpit again? Sure. Let's try that. So we're going to now put this underneath the armpit. And we're going to. Yep.
Yep.
And the button's been pressed there.
Hold on 1 second. You go ahead, Dr. Paul.
Yeah.
Please. Now it's on, yep.
Okay, good. So yeah, we can see that glowing there. So you're getting kind of 3D treatment of that whole shoulder. And you just looked at it under ultrasound over there.
We did.
And it looks good, right?
Yes, I'm so excited. The surgeon is here. So this was an official post-op visit in addition.
That's convenient.
We were able to look at the 3 anchors in the supraspinatus, as well as the biceps tenodesis, which we detach it from its slot, use it kind of a little purse string and cinch up the labrum, which is the sock that goes around the entire joint, because that was also torn, and everything looks fantastic.
Awesome. All right, well, speedy healing to you. No one deserves it more than you do, and get better quick.
Thanks, Dr. Knob.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.